All right, this is my workbook and advanced treatment video, and those accompany a workshop. I have a chapter in this book on movement stability and low back pain, the essential role of the pelvis, and then this is a fabulous master's thesis that was done by Luann Olson called Effects from the Hesch Method Pelvic Mobilization on Lumbar Flexion, Straight Leg Raise Performance, and Standing Pelvic Inclination Angles in Patients with Low Back Pain by Luann Olson, MS. She's now DPT, and this puppy is several hundred pages thick. And my complaint, not enough pictures. Please, more pictures. It's about 150 pages long. And I also have some pelvic models, which are really nice because they're flexible. You can practice the spring test on them. That's a large, and then here's a small one. This was developed by Thomas Dorman, who was presented at some of the congresses on the SI joint. And what's nice is they're very flexible, and this one fits in your pocket. And contact me if you're interested. What makes me a little crazy is to take an SI course where someone pulls out a matchbook and tells you, imagine this is a sacrum, and that's pretty difficult to do. I think that all educators need to put out a little bit of money and purchase anatomical models and at least have one at every table. It's pretty difficult to look at a matchbook and say, okay, that's a sacrum, and now I'm looking at a transverse, or rather an oblique axis. So there's my complaint. Here is a view from an anatomy book, and my gosh, you know, the contents of that sciatic notch are incredibly complex. And out here very medially is the pudendal nerve and pudendal artery, and of course here's that large sciatic nerve and the tibial nerve, and branching out of the cluneal nerves and gluteal nerves, etc., etc. I forget the number of structures that come out of there. I believe the number, it's at least 13. And it's good to review that. This, of course, is the big piriformis muscle, but don't forget the gemelli that take a different angle, and don't forget the quadratus femoris muscle, which is a very different angle and requires a very different stretch or mobilization maneuver. I'm going to stop talking here. Thank you very much.